This is the heartbeat of human services, a peek into the inspiring stories of our community and all things DHS. Join us.
Hey there, everybody. I'm your host, Janice Slagle, for the podcast, The Heartbeat of Human Services. And today we are privileged to have a guest named Veronique Hayes, and she's going to talk to us a lot about our plan to reopen to the public and a lot of things that we're doing to make sure everyone feels safe and knows exactly what's going on here. So welcome, Veronique.
Thank you, and thank you for having me today, Jana.
Yeah, we're excited to hear from you. We know that you have a lot of knowledge about policies and just how we operate. So before we kind of begin asking content questions, can you just tell us when did you start working for DHS?
So I started working for DHS about 28 years ago.
Okay.
Yes, I actually started as a BC intern.
Oh.
That's how I started for the department.
Okay, what's a BC intern?
Bakersfield College.
Oh, okay, they had
internship.
interns.
They had an internship program. And so I did the summer internship program in June of 1994.
Okay.
And shortly after, I became an extra help eligibility worker. And I think that was in like September of 1994. Very shortly after that, I became a permanent employee.
Wow.
February of 1995.
Wow.
That's when I started.
So many of our managers that we've spoken with have started out as extra help eligibility. I think even our new director, Lido, that we spoke with last week, he started out as extra help. And so did Dina Murphy. And I think Cindy Utes did. So
really?
Isn't that interesting?
I'm in good company.
Yes, you are in good company. And I think it's important for new employees to realize you can go places here, can't you? There's a lot of opportunity.
Absolutely. There's so many different opportunities. I also worked in the appeals unit where I represented the county when customers disagreed with actions taken on their cases. And so that's just one different aspect of the department. It's called the appeals team. And we actually presented our cases in front of administrative law judges. Wow. So that's something that people don't know about that we also have available in our department. I also worked in staff development. And so I was a training supervisor. I was a mentor. So I assisted new trainees as they became eligibility workers. I supported them throughout their process and learning the programs.
Wow.
So there's so many different aspects of our department that are available to people.
I bet the job where you were listening to people's complaints and things really taught you a lot, didn't it? The one that the pills, is that what you called it?
Absolutely. Taught you a lot about the importance of really reviewing the cases and making sure they were accurate, and also really listening to the customer when they're calling in and complaining or disagreeing actually with their case actions. And it gives you an opportunity to really talk through some processes, because a lot of times a customer is not necessarily disagreeing, but not understanding why an action was taken against their case.
That's so important.
It's a good opportunity to really have those conversations.
So you've probably developed quite a lot of problem solving skills with all these different aspects of the job, right?
Absolutely. But what a learning experience.
Yes, I love that. I think those tough, challenging things really do give us more skills for the future, don't they? So, and during COVID, so we're coming hopefully on the other side of this whole pandemic now, aren't we? We've been opened a little bit to the public, but we've really been able to help people online through COVID.
Yes.
And now we're approaching a different season. So tell us what your current role here is at DHS, Veronique.
Okay. So I am a program director, and I have oversight of the Lobby Management and Continuing Services Division in the Employment and Financial Services Bureau.
Okay.
Our bureau administers all public assistance programs, including our CalWorks, our CalFresh, Medi-Cal, our CAPI programs, general assistance, our refugee and trafficking programs, and our homeless assistance. We also assist CalWorks families with employment and training as they move towards self-sufficiency.
That is a huge lot of acronyms and things. That's a lot of stuff you do, though, and that your bureau does. That's amazing. And we've spoken with some other folks about, some of these things that you mentioned, but how and what has your team learned, and how have you operated a little differently during this season of this pandemic?
So since the beginning of the public health emergency, there have been many adjustments made to ensure our staff and customers remain safe as we continue to provide services for our community. One of the first steps was to ensure safety of staff. So a plan was established to allow staff to work from home in order to minimize the number of staff in the office. In June 2021, the department brought staff back to the office. However, we continue to allow staff to work from home on a hybrid schedule, as long as they were able to perform their essential duties remotely. Staff can now work a hybrid schedule where they work 1 week in the office, 1 week at home per pay period, or they work 2 to 3 days a week at home or in the office. Currently, we have approximately 55% of our eligibility staff working a hybrid schedule.
That is awesome.
Yes.
I just have to say hats off to all of you for that. And just to be able to switch like we have, it's a huge change, isn't it?
It's a huge change, but what an opportunity to utilize our technology in this way.
We've all really learned how to use different things. Like who even knew Zoom and Microsoft Teams before, right? That's just like a staple now. But I love that we trust our staff and that they're still able to get all their work done working a hybrid schedule. And it to me, it speaks to really looking at our staff as part of our team and making sure their needs are met too, right? That's so important, isn't it?
Absolutely. And like I said, what an opportunity to really try a hybrid schedule or working from home opportunities for staff.
Yes.
We've talked about it.
We have.
But never really got quite there yet. And unfortunately, we were forced to go there, but it worked.
It did.
And it's continuing to work for our staff.
Yeah.
One of the other things that we needed to make sure that we did was to keep our teams updated on the many challenges and utilizing technology to communicate and interact with staff. And so we were able to continue communicating with staff utilizing Teams, as you just mentioned. We assisted with staying connected. We hosted meetings and we continue to chat with our staff. Our federal and state partners, they also quickly recognized that counties needed to support to continue to provide needed services while remaining safe. So there were many waivers that they approved that supported social distancing and utilizing technology to complete daily tasks.
So we had to get probably more laptops and things like that, and then sign forms to allow us to do this kind of work. That's what the waivers are all about. Is that right?
Yes. Well, the federal and state waivers were more case processing based.
Okay.
So we were able to have waivers to waive the application and renewal interviews in some cases.
Okay.
So that was
great.
huge for us.
Yes.
We also, the interviews that we were not able to waive were conducted over the phone.
Which that must have helped people so much.
Yes. So even if you're working from home, you're working in the office, you could still manage your cases because you were conducting most of your activities over the phone with customers. We were able to sign mandatory documents utilizing the e-signature process. The suspending of the required face-to-face contact was huge for us.
Yes. Right.
We also had waivers to provide good cause for customers that were required to participate in the Welfare to Work program. So that was huge also. We weren't asking customers to go out and try to find jobs during this pandemic.
That's
in
good.
an effort to keep them safe also.
Right. And for a season, there weren't a lot of jobs. I mean, things were really shutting down. So we morphed to what was going on in the community, which says a lot. So that's great.
And also it was just as important to continue supporting our customers and providing them different options to connect with workers during this time. So that information was so important to be communicated at each interaction. Customers were provided information about self-service options that included utilizing our online website, which is called Benefits Cal. And it allows customers to complete and submit applications, receive electronic mail, complete their annual renewals, report case changes, and upload documents and verifications.
That makes it so much easier for our customers. I think that's key right there.
It was actually one of the biggest pieces to connecting and continuing to communicate, giving them those additional options.
I love that. That is just so good. So timely that Benefits Cal just kind of started kicking in. And then all of this too, right? It was a really...
So we had See For Yourself first. We just transitioned to the new program in September of 2021. So prior to Benefits Cal, we did have See For Yourself, which allowed these same options for customers.
But with Benefits Cal, can people, they can sign up for more things than they could with See For Yourself, right? Is that right? Like they could do Medi-Cal and CalFresh and some other things?
It was pretty much
It was pretty much? Okay.
Yes.
All right.
Yes. But it wasn't, I think with the transition, or because we were in a situation where customers weren't able to really come into our offices, this became really a primary way to for customers to provide their
access
their applications, their documents, their verifications.
So they could just upload on their phone right there, take
Absolutely.
a picture, upload it. That's great.
We also have our interactive voice response system, which allows our customers to receive automated message reminders for their upcoming appointments. They can get case information such as benefit amounts and worker contact information. And then we also have our internal email that customers can use if they're not utilizing the online website. The internal email allows customers to email documents and verifications to their workers. So many different options for customers. If they're not using the app, the Benefits Cal or See For Yourself, there's still other options that can be utilized.
And most everyone now really does have a phone. I mean, even if there's not a budget for it, there are ways to get phones reasonably, aren't there? So the phone system works. If you don't have email, you don't have anything else, at least you have a phone. That's great.
And so then there were significant changes to the structure of our lobbies. Pre-COVID, our lobbies were open to the public and most services were offered in person. Currently, and since the beginning of the public health emergency, we have a limited number of customers in the office, and we are triaging all customers outside of our lobby. All homeless customers without phones and those that have a scheduled appointment, they were invited in, placed in an interview room with a phone, and were connected to a worker that way. All other services were provided outside of the office, including applying for benefits. EBT cards and medical cards were mailed to customers. We have begun a phased-in approach to fully reopen our lobbies at our main office. Phase 1 began August of 2021 and included inviting customers in the office that were picking up their EBT cards or wanted to use our kiosk to upload documents or verifications. Phase 2, which will begin April 18th, we will be expanding our Phase 1 by inviting those that choose to complete their application in person to be placed with a screener to complete the application process. Phase 3 will be our full reopening and is tentatively scheduled for this summer. And all of our district offices are currently fully reopened to the public.
We now interrupt this podcast to bring you job seekers some important news. At DHS, we have resource rooms designed to help you find the right job. These rooms are located in each of our district offices, similar to our Jobs First room. Each room is equipped with a bank of computers for our customers to use, where you can search for jobs online, complete applications, work on resumes, and have job developers from employer training resources available to assist you. As part of our soft reopening plans, our employment services team will open our resource rooms to the public in our Lake Isabella, Ridgecrest, Taft, and Shafter offices. Resource rooms in Delano and Mojave will remain closed as we complete construction projects. Our Jobs First room in our Bakersfield main office will reopen as soon as our lobby is fully open to the public. This concludes today's news. We will keep you updated. My name is Gloria, and this segment was brought to you by DHS Employment Services. Now back to our regularly scheduled podcast.
So since people are getting used to doing everything online, are the lobbies that are open, are they experiencing less people in them?
They are.
That's good.
They are experiencing less because, like you've said, customers have so many different options now.
Right.
And they're used to utilizing those options and really realize and recognize that they don't have to come into those offices for services and they will still be served at the same level.
Especially with gas prices, right?
Yes.
Being what they are, it's kind of nice that you don't have to drive somewhere and you could do it all online. I love that. So maybe even and when we say our main lobby, we're talking about the lobby on California and Union. That's our biggest office, right?
Correct.
And so possibly even this lobby will have maybe less folks coming because they've learned how to do things online too. But I guess we'll have to see how that works, huh?
As we continue to reopen in the phased-in approach, we will be able to see
to gauge it. Yeah.
So that is definitely what we're hoping.
Right.
Is that customers really understand that they can utilize those customer service options and still be served at a high level without coming into our offices.
That's so good. So, and I'm sure that many of the folks that are working this hybrid schedule that work in these areas, are we having more staff working live then as we transition, or are we kind of keeping it the same? Or
we're keeping it the same. But most divisions have a number of their staff working in the office just in case we have to have some face-to-face interaction.
Yeah.
We do have some staff in the office to meet those needs also.
Very planned out. And, I've been down to the lobby several times, and in the past, before COVID, it was, with a lot of people in there. How many people would you say, and I know it's hard to gauge now because we haven't been open to public, but approximately how many people are served through your area?
So prior to COVID, the OC Seals lobby served between 8,000 to 10,000 customers a week.
A week. 8,000 to 10,000. That's huge.
Currently, my lobby team serves between 800 to 1,000 customers a week.
Okay.
But it's also important to note that the services we provide haven't changed.
Yeah.
The only change is we're continuing to limit the number of customers that are invited to come into our office for assistance. Anyone that needs to apply for benefits, submit documents or verifications, pick up documents, an EBT card or benefit issuance card can still do that either in person or by using the self-service options.
That's great. So we're still helping a lot of people. And we're just doing it in a different way, more effective ways.
Absolutely.
Right? That's awesome. And so we sent out a survey to our staff internally here, and there was some different things they were wondering about. So I wonder if you could talk about what we're doing to help our staff feel safe while they return to front-facing work in the lobbies.
Absolutely. So since the beginning of the public health emergency, the department has followed all safety guidelines as set forth by CDC and Cal OSHA, and we continue to as we move towards fully reopening our lobbies and returning to pre-COVID protocols.
That's great.
We also continue to support work from home, so there's limited staff in the office. There are masks available to staff and to customers. There's hand sanitizing wipes available throughout the department and in our lobbies to wipe down any common areas or personal space as needed. There are cleaning protocols that have been established that include cleaning and sanitizing throughout the department between 5 and 8 times daily.
Wow, that's great.
All interview rooms, lobby counters, our kiosk screens, the doors, the benches, the mail drop boxes, lobby phones, floors, they're sanitized nightly. At any time, an employee can request a rapid response cleaning. So this is usually done if there's a report of an employee or a customer that has been in contact with someone or has reported they have COVID. Also, if an employee has health issues and is concerned about working in the office, they can work with their healthcare provider and our human resources team to accommodate their health and safety needs through our interactive process. So we have a lot of things established to support not only our staff, but our customers during this time.
And I know when people come in, there's different, even if you meet at a window, there's like a screening, there's something covering them, like a plastic or whatever that's made out of to cover them, and they can see. So there's that feeling of, I can talk to you, but we are a little bit separated, so we're protected that way, right?
We do have those plastic barriers available. And so if we have a customer that comes in that wants to conduct a face-to-face interview, we not only have those barriers in our interview rooms, but we also have a screening section that has really tall barriers that we're going to use for face-to-face interviews so that not only our customers are feeling safe, but also our staff.
That's good. So it sounds like you've thought of everything.
We're really working hard to make sure that not only our staff are safe, but our customers are safe also.
Yeah, that's wonderful. Well, I know when I walk down there, it smells clean, it looks clean, and I'm excited to see how all of these changes that we've implemented are going to make it even better, because I think the more we can do online, the more we can do with customers on the phone. It makes it easier for them, especially if you have children, you have to cart them places, and it's just a much better process for everybody.
Absolutely. And we continue to talk about the self-service options that we have available to customers. And so they are fully aware, and they've had good practice. Really, we've been in this public health emergency for about 2 years now. And so not only are they in good practice on what services are available using the self-service options, but our staff are also used to having those conversations with the customers. So yes, it will be interesting to see when we fully reopen how many of our customers continue to use those self-service options. We really hope that they do, because once again, the same level of service is still expected, and the high level of customer service will still be there.
So when we do come out of I know we're not officially out of the public health crisis, will those waivers have to be redone, or were we going to just keep things similar to how they are with regard to hybrid schedules and people submitting things not having to do face-to-face? Do you think that will kind of stay in place?
We're expecting some of those waivers to be lifted.
Okay.
And then we will slowly transition back to our pre-COVID normal protocols. But once again, self-service options will still be fully available.
That's great.
Yes.
That's great. Well, I think people can feel safe, staff can feel safe, our customers can just know that we're doing everything within our ability to make them safe. Lots of cleaning, really, really good things that are being done to make everyone safe and make sure that their needs are met. So thank you so much, Veronique. Is there anything else that you want to say about this journey, phase 2 and phase 3, as we approach those phases to reopening?
I think we made a conscious effort to reopen our lobby slowly so that we could get it right. And we could continue to keep our staff and customers safe during this time. And I think that was really important to do. Like I said, the federal and state partners continue to support us by extending these waivers so that we can continue to make sure that we have these other options available to both our staff and our customers as we slowly move towards reopening not only our lobbies, but really our department and our communities.
It's a very thoughtful process.
It is.
And it sounds, I feel great about it. And I thank you for being our guest today on the Heartbeat of Human Services.
Thank you so much for having me today. I really appreciate you giving me this time to talk about our area of the department and the efforts we've made to ensure staff and customers remain safe during this time.
Thank you, Veronique.
Thank you.
I'm your co-host, Paula Hernandez, and let's get into today's Mindful Minute. We will be talking about conscious breaths. Breathing exercises are one of the oldest meditation practices. They are powerful tools for relaxing both your body and mind. Some simple breathing exercises can make a big difference if you make them a part of your regular routine. Join me as we go through some breathing practices. First, get comfortable wherever you are, whether that's your work chair or sofa at home. Now close your eyes, and taking a few big deep breaths, breathe in and imagine that the air is filled with a sense of peace and calm. Then breathe out. And while you're doing so, imagine that the air leaves with your stress and tension. And continue this for as long as you need until you feel rebalanced. Deep breathing enthusiasts say you should practice deep breathing at least 5 to 10 minutes 3 times per day. But I think anyone could really benefit from doing this just a couple minutes a day when you're feeling most anxious or stressed. It's a quick way to reset and get your mind into a good headspace. Thank you for listening. This has been your Mindful Minute.
Thank you for joining us for the Heartbeat of Human Services podcast today. We hope you'll join us next time.